Hello everyone, welcome to my video channel. Today I am going to cover regarding a surgical site infection part 2. In this video, we should be able to answer certain questions. That is, number 1, define A. Incision wound, B. Abrasion wound, C. Laceration wound. Number 2, define what is wound breakdown or wound dehiscence. Number 3, in interlocking nail tibia, what are the implant modalities that can decrease the rate of surgical site infection? Number 4, additional note regarding scar. Yes, the disclaimer is the same in all my videos. Thank you. Now let's begin. In my previous video, I already defined what is a wound. In this video, another definition of wound is, it is defined as a separation or discontinuity of the skin, tissue, mucous membrane caused by physical, chemical, or biological insult. Wound also can be classified based on 1. The duration, or 2. Whether it is closed versus an open wound. For number 1, the duration. Based on duration, wound can be divided into A, an acute wound, whereby there is an injury to the skin that occurs suddenly. It heals at a predictable and expected rate according to the normal wound healing process. B. In a chronic wound, it develops when an acute wound fails to heal within an expected time frame, which may occur after a few months to years. Example, in a chronic diabetic wound ulcer. In number 2, whether it's a closed wound or is it an open wound. For a closed wound or non-penetrating wound, it is a result of blunt trauma or friction with other surface. The wound does not break through the skin. This includes this type of wound: A. Contusion or bruises. This is caused by a blunt force trauma that damaged the tissue under the skin. B. Hematoma. It is caused by damage to a blood vessels that in turn causes the blood to collect under the skin. C. A crush injury. It is a closed wound that occurs due to extreme amount of force applied to the limb over a long period of time. For an open wound, this example include A. Incision wound. It is a wound that is caused by a clean, sharp-edged object such as knife. For laceration wound, it is a rough, irregular wound that is caused by a crushing or ripping force. C. Abrasion wound. It is a superficial wound in which the outer skin layers are scraped off, often caused by a sliding fall onto a rough surface. For D. A puncture wound. It is caused by an object puncturing the skin, example, nail or needle. E. Penetrating wound. It is caused by an object, example, a knife, that enters and coming out from the skin. F. Avulsion wound. It is an injury in which a body structure is forcibly detached from its normal point of insertion. G. Gunshot wound, caused by a bullet or firearms. Another wound that I would like to discuss are miscellaneous wound. The example include thermal wound. It is due to extreme temperatures, either too hot or too cold, where it can result in a thermal injuries like burns, example sunburns or frostbite. For chemical wound, this result from contact with inhalation of chemical materials that cause the skin or lung damage. The bites and the stings wound. Bites can be from human, example a teeth bite, the dogs, the cats, the bats, the rodents, snakes, etc. etc. For electrical wound, this usually present with a superficial burn-like or sting-like wound secondary to the passage of high voltage electrical currents through the body and may include more severe internal damage. In the next question, how do you define a wound breakdown or wound dehiscence? Wound dehiscence is a partial or total separation of previously approximated wound edges due to a failure of a proper wound healing. It usually occurs 5 to 8 days following surgery when the healing is still in the early stages. The causes are similar to the causes of poor wound healing. These include ischemia, infection, diabetes, malnutrition, smoking, and obesity. What is superficial dehiscence? It is when the wound edges begin to separate and whereby there is an increase in the bleeding or drainage at the operative incision site. Well, next, this is one of the viva question. In interlocking tibia nail, what are the implant modalities that can decrease the rate of surgical site infection? Well, guys and girls, any clues or ideas? Let us pause for a while. Okay, my answer is, drum roll please. Close intramedullary fixation, or whereby we use a mini open approach. Interlocking nail permits fixation without removal of the fracture hematoma and the resulting loss of the needed osteoinductive factors. It maintains a proper biological environment, including an intact soft tissue with blood supply. In interlocking nail, there is a less soft tissue trauma. Interlocking nail also provides an adequate mechanical stability with better in terms of fracture alignment. Interlocking will help reduce the inflammatory response at the fracture site. These factors helps in reducing the incidence of surgical site infection. Well, would you consider antibiotic-coated tibial nail in an open difficile tibial fracture in reducing the rate of surgical site incidence? I am going to quote a study from Tommaso et al. 2021. In this study, they analyzed the use of antibiotic-coated nails in the open fracture and infection rate incidence. This retrospective study concluded that gentamicin-coated intramedullary nail might play a role in the treatment of open tibia fracture in terms of reducing the fracture-related infection. But this study has a limitation. Okay, now I just want to cover regarding an additional note regarding scars. What is scar? A scar can be defined as a fault or blemish resulting from some form of condition, wound, sore, or burn. Scar formation is a consequence of wound healing in which the normal skin is replaced by a fibrous tissue. This scar tissue lacks the characteristic of normal uninjured skin. Scar can be classified as mature scar, immature scar, linear hypertrophic scar, widespread hypertrophic scar, minor keloid, and major keloid. What are the presentation of scar? Scar can present as a mature scar. There is light-colored flat scar. B. Immature scar, presented as red, sometimes itchy or painful, and slightly elevated scar in the process of remodeling. Many will mature normally over time and become flat. C. Linear hypertrophic, example surgical or traumatic scar. It is red, raised, sometimes itchy scar confined to the border of original surgical incision. D. Widespread hypertrophic, example burn scar. A widespread red, raised, sometimes itchy scar that remains within the borders of the burn injury. E. Minor keloid. It is focally raised, itchy scar extending over a normal tissue and may develop up to 1 year after injury and does not regress on its own. F. Major keloid scar. It is a large, raised, more than 0.5 cm scar, possibly painful or pruritic, extending over a normal tissue, often resulting from minor trauma and can continue to spread over the years. The ideal scar. What do you mean by that? The characteristic of an ideal scar which make it cosmetically favorable are: 1. It should be a fine line. 2. It should be parallel to the skin creases, folds, and RSTL, resting skin tension line. Number 3. It should have a similar color and contour as the surrounding skin. Number 4. There should be no distortion of the adjacent structures. Number 5. It should be at the level of the skin. What are the criteria for a scar to be considered for a revision surgery? Among them include disturbing the anatomic function or distorting the facial features, where the scar is a poor mesh to the surrounding tissue, the scar lies against the relaxed skin tension lines, the scar lies adjacent to but not in a favorable site. In hypertrophic scar, it can be considered for a revision surgery. In a contracture scar, whereby this scar restrict movement due to skin and underlying tissue that pull together during healing and can occur when there is a large amount of tissue loss or where there's a wound crosses a joint. Yay! Finally, we have reached the end of the video. I hope you have learned something from this video. See you in the next video. Take care and bye.